Good afternoon, everyone, and welcome to the COVID-19 2.0 Health Literacy Echo for Providers, brought to you by Health Confianza, a collaboration between the UT Health San Antonio and the San Antonio Metropolitan Health District. We are going to record the session today so we can share it later, but please note that anything listed in the chat will be seen in the recording. And thank you very much for making this time to priority and join us today. My name is Raquel Romero. I hope you and your family are doing well, and I'm going to be the facilitator for the ECHO session today. We have a lot of information to cover, but before we begin, I would like to ask our UT ECHO IT, Carly, to provide some direction for us.
Hi, please stay muted unless you're speaking. You can use *6 on your phone if called in, or the microphone icon on the bottom left of your screen if you join on a computer. You can also communicate with the chat feature. If you're having issues with your connection, you can privately chat with me, UT ECHO IT. Thank you.
Thank you very much for these directions. Yes, please remember that if you have some issues with the connection, you can add your comments in the chat box or send a private message to the UT ECHO IT. And I would like to invite you and encourage you to please add your comments, your perspectives, your questions, and your feedback in the chat box. We will try to address them through the session today, or we can follow up by email. You can reach out to us after this session by email. And we promote interaction in our sessions, and we would like to see everyone's faces. And if you feel comfortable and if you're able to do, please join us by video, particularly in discussing part of the session. Just remember that no personal health information is allowed within discussing cases and scenarios. I would like to mention that these sessions are open to everyone. Once you register in one session, you automatically will be registered in the complete series. And please follow up in our next sessions. I promise it's going to be very informative. Please join us in our following sessions. For our attendance records, I would like to ask you, please enter your name and your title, contact information, and institution and the organization that you represent in the chat box. Again, this is for our attendance records. Health Confianza is a county-wide collaboration to improve access and the uses of COVID-19 health information and services in Bernard County. With that, I would like to start with the introduction of our COVID-19 Health Literacy Echo. I would like to start with our lead specialist and moderator, Dr. Bergen.
Hi, welcome everybody. This is COVID-19 2.0. We have lots to learn because COVID is an ever-moving target. We decided to open this second round of COVID Health Literacy ECHO webinars with pediatric vaccine very intentionally, because we know that we are about 10 days to 14 days away from school starting, and there are plenty of children who are vaccine eligible that have yet to be fully vaccinated. So we wanted to get some good information, updated data, and talking points out to everybody who interfaces with patients. You are welcome to attend, whether you are an MA, an LVN, a healthcare provider, MD, PA, DO, all are welcome, as the issue is to get people that are actually patient-facing. As we progress through the ECHO series, which will be taking place every other Friday for 10 sessions, we will cover topics such as outpatient management of COVID-19 infection, updates about vaccines and boosters and variants in the adult population. We'll be talking about long COVID in adults and pediatric long COVID. We'll talk about incorporating cultural awareness into clinical communications about COVID-19. And a really important topic is going to be myth busting and digital health literacy. How do we assist our patients in getting good, accurate information? And how do we skillfully regain their trust as we bridge respectfully from the myths that they've been hearing from online and from other sources to the facts that we want them to remember and take away. So with all of that said, here we are, we're launching with pediatric COVID vaccine, and I will give the microphone back to our moderator, Raquel Romero. Thank you.
Thank you very much. So thank you very much for these words, and welcome to everyone that joins today. And I would like to continue with the introductions for our Confianza. I have Dr. Svatek.
All right. Thank you for having me. This is my second iteration of talking about going through this process of the whys and hows of the COVID vaccine for children and what that healthcare professional approach should be. So I've got 3 established objectives here, which we'll go through, but just for a quick glance. But I think most importantly is, what's been going on in your world and understanding that and how we can switch gears. So, I know that I've oftentimes, asked these 3 questions or statements to myself. I face COVID hesitant families for the vaccine. I feel like there's minimal time. I'm a pediatric hospitalist taking care of sometimes up to 20 patients, and it might be difficult to find that time. And then sometimes my approach, I step onto that ward and talk to that family and then take a step back and think, I could have done better. And so, the game plan, I always like to have this team approach, is to understand that we can get through these experiences and explain what's going on and develop from these experiences to talk to families better. And we do know information, right? Even though it's ever changing, but we can inform them and explain to them what's going on. And so I always like to use, anytime I'm talking about vaccines, this timeline that I established myself. There's so much more to put in there. But it started, back in the 1700s with the smallpox outbreak in Boston, with over half of the community being infected with smallpox. And it took some time to develop the vaccine over time. And then we even know that infant mortality rates were extremely high in the 1900s. I have a personal story, so that always adds to why I really try to promote vaccines. In 1955, we have the polio vaccine developed, but unfortunately in 1954, my mom developed polio and obviously had some morbidity associated with that. And that, should there have been an opportunity to vaccinate her prior, she might have gone through different experiences. But knowing that, so since the 1960s, we've had the Advisory Committee on Immunization Practices. So that's been around and established for a long time. And then knowing that there are resurgence of cases for different reasons. Some of our population just didn't have access to the vaccines. So in the 90s, we have vaccines for children that was developed so that we could distribute equally within our community. And then understanding, we're in South Texas, we have, immigrated population, sometimes that isn't vaccinated for different diseases such as pertussis. And we had a high number of cases in 2013 for pertussis cases where we had to be treating these individuals in the hospital. And then as we have vaccine hesitancy and outbreaks such as in, Disneyland, in California, those sort of things are still happening in our world. And then now here we are with the COVID pandemic. And so this, I think, is a good distribution of why there is vaccine protest and hesitancy. So it's important to seek to understand and look that there are different causes, and you could probably add more causes to that. Oftentimes people are just simply worried about side effects. We have misinformation out there, and unfortunately we have intentional disinformation out there, such as we've seen in the past with autism and this incorrect association with MMR vaccine, as well as HPV and this incorrect association with infertility. We have parents that are worried about vaccine overload. They have different philosophical or religious beliefs, concerns of, about the ingredients that are within these vaccines. And then just, individuals are concerned about their personal right. And so decision to vaccinate. So we've had all of these historical instances you can see on the right side as early as the 1800s. And then Supreme Court rulings in the 1900s where people were refusing to receive certain vaccines that were mandated, and knowing that this is happening in other countries as well, knowing that we are trying to do better to have vaccine, reportable side effects, and what we can do to help that. And so we have in the 80s, we developed the National Childhood Vaccine Injury Act. The US, FDA is always looking to better things. And even though there is disinformation, just to make improvements based upon what's going on and what the word is in society. But understanding sometimes that mandates can create, a lot of concerns with parents and families refusing, and how can we solve some of those problems. So primarily, this is to educate on, the COVID vaccine and how we can do better with that. And always with that, I'm about what's going on in our country, our community. And this was taken from the CDC. We have accumulated over 14 million positive childhood COVID cases that were reported in the US. And Texas actually wasn't included on there because Texas always didn't include on their monthly data the childhood, the pediatric population, but we estimate about 1.25 should be added to that 14 million. And then this encompasses, close to 20% of all cases that did come up in the US since COVID started. Children make up about 20% of our population. We can see with the new BA variant, the changes in cases. Back in March when I presented, we had, close over 27,000 cases. Now we have over 95,000 childhood reported COVID-19 cases as of this week. And then the cumulative hospitalization rates, fortunately, remain to be low, as well as the mortality, but we'll talk a little bit more at the end, because you don't want to be in those numbers where they're hospitalized or children die from COVID. What's interesting to see from our Metropolitan Health District, their last monthly epi report was done in January of 2022. And we can see that the colored lines represent mainly our adult population. You can see the dotted lines are our pediatric population. Yellow is 0 to 9, green is 10 to 19. But you can see as some of these percentages of cases on the y-axis have decreased in time. You can see for children, we've actually started to see an increase in slope as COVID rates had decreased back in December, but then took a boost again with the Omicron variant. We saw a spike, and then they started being at the top as far as the number of cases for our pediatric population. And then, just like everybody's talked about, this is back to school. So last year, with our school reported COVID cases from the Texas DSHS, we can see these spikes where we have the Delta variant for children, the positive student cases reported, you can see here, was at 40,000. And then as we developed into the Omicron, we were near 100,000 cases spanning, this is from September all the way into that February of 2022. And then you can see that the staff count, many staff members were probably getting vaccinated during this time, but we did again have that Omicron spike. And so as the efficacy went down and with the vaccines and starting to encourage boosters, we also started to see cases jump up. So our childhood COVID vaccine data, so this is why I'm presenting, because we still have work to do. We can see, 6 months to 4 years, just a couple of months ago, we were able to start vaccinating that population, and we still in the US have about 17.7 million children in that age group yet to receive the vaccine. The 5 to 11, it's actually still about 18 million yet to receive. And then the 12 to 17, we've made headway in time. We've had the opportunity to vaccinate those children. And so that number is less, but still we still have some headway to go. And that's at 7.7 million. So you can see this is put out by the AAP and doing their analysis for the proportion of US children 6 months to 4 years who have received the first dose of the COVID-19 vaccine. So we in Texas are only at 2.1%, but you can see some other states such as California, are establishing much better at 8%. But just knowing that we have room to grow. And then this is the Metropolitan Health District in San Antonio, looking at our vaccine rates. So for the 5 to 11, we're a little bit below that average for fully vaccinated. We're still a little bit below, but similar averages in that 12 to 15 and 12 to 18 age group. So the one other striking thing that I pulled from this data, you can see the numbers of, by race and ethnicity, the numbers that were vaccinated. And you can see that our highest population in San Antonio overall for our population, Hispanics are at 43.1%, non-Hispanic white are at 25.7%, but we have room to do with our non-Hispanic Asian and our non-Hispanic Black population, which are only, their fully vaccinated rate is for Asian at 2.3 and for Black at only 3.9%. So understanding our population is important, and understanding that there is hesitant individuals out there, but it actually isn't as much as we might think. It's just the time that we have to take to really incorporate trying to answer those questions and get those parents and individuals to vaccinate. And so you can see at the bottom of the spectrum, when they did some studies and published, we mainly have unquestioning acceptors. Then we get to some that have minor concerns. Then, there is lesser of that population, but the hesitant population, the late selective, and then it's actually a smaller population of the decliners. And so from the AAP, we can see one of their studies shows that the rejectors here is less than 1%. It's that hesitant population at 30% where we want to, develop that trust. And how we do that. How do we develop that trust? So we know that probably 1 in 4 parents reported serious concerns towards vaccinating their children. So we need to take that time. We know we need to also understand that on a CDC survey at children 19 to 35 months, they actually aren't following their routine vaccine schedule in general. But studies have shown with pulling multiple studies together and examining those on these systematic reviews, this was pulled, is that these are the key pieces, that it's not just one strategy, but it's a multi-component intervention that's key. And so starting early, building trust, understanding your audience, and then presenting vaccines as, the default approach. It is the norm. And then providing those educational materials, having your own stories, being that healthcare professional that can be there for that family or individual, using your technology, how you're centering both on the child and the community in which you're living, and then having those plans to deal with misinformation, and trying to have a good approach with that. And then really trying to improve those patient vaccine literacy skills. So me as a pediatrician, we've always gone with that presumptive approach. So I know sometimes I'll have a medical student or resident ask a family about the flu vaccine and would they like to receive it. And when that individual, that resident or student is presenting to me, they said, well, I asked them, they don't want it. And then we go in and we talk about why their child is there in the hospital for perhaps a respiratory illness. And then if, they develop something like the flu, it's important that we vaccinate, and we would like to go ahead and give your child the flu vaccine. So my approach has always been a little bit different to get to that presumptive, because we know from studies, even, a randomized controlled trial on, looking at 29 clinics and the HPV vaccine, they looked at over 17,000 adolescents, and they had different arms. They had those that received that presumptive announcement versus a control that those healthcare providers were not trained, versus those that were trained to have that conversational participatory approach. And we found that the uptake for accepting the vaccine was about 5% higher than in the control and the conversational group. So we do know the presumptive works, but there's a little bit of a but here. The COVID vaccine is new. And so this is going to take some time to develop into getting into that presumptive approach. We're still learning, we're still getting information, but we can still use some key features and then use our stories and make those personal recommendations. And so that's where we need to look at our motivation. As Dr. Bergeron has always done in her ECHO series, I think that these are great key points, is understanding and setting the tone, using plain language, active listening, acknowledging the different perspectives, and then bridging respectively from myth to fact, and then doing that teach back. These are really important key approaches. And then even before we start those approaches, there are other things that you can do ahead of time. So how can you even start if you're that healthcare provider in that clinic? You can start creating letters. You can have posters in the office. You can tell your own stories. You can talk about effectiveness, but then also talk about the side effects, and then use your social media platforms to help. And then if you don't have the ability to give the COVID vaccine in your clinic, giving them the resources where in their community that they can receive the vaccines. The other item is, doing that homework. It doesn't, I think everybody has it in their mind. It's just putting it kind of on a piece of paper so that you can see and look at those key talking points. And so I've given you a lot of data at the beginning, and that's because we're healthcare providers, healthcare community. It's important to see that, but be careful in dumping that onto a family's. I think it's easier to talk about kind of, risk and defining how you would define common, rare, extremely rare, but trying not to get really honed in on exact numbers, because it's really hard sometimes to memorize numbers and these numbers change. But understanding to keep up to date on the current variants and perhaps how that protection has waned from the vaccines. And that's why we're looking at boosters and newer vaccines. And then risk benefit. So while I'll show a couple of slides on that, side effects in myocarditis, we're going to even talk about a case. Sometimes it's better to explain that if you're going to use those percentages, that it's 99% safe as opposed to saying 1% experience side effects. And then, a lot of individuals come in with herd immunity, and it's important to really have that focus of that individual you're talking to, and who is their surrounding community, who are their surrounding family members that could potentially be affected should they develop COVID or their children develop COVID that could experience extreme complications. And so here's my risk benefit weight. This is kind of how I sometimes look at things and try to explain things and get them in my brain. As far as risk, we're looking at, sometimes with the COVID vaccine, people have, concerns about side effects and rare adverse effects, as well as missing school from actually receiving the vaccine. And then as well as having concerns that, if they give the vaccine now, we have a future variant. Is that going to actually protect or not? And then them not having that personal choice, these are things to think about. But then where the benefit is, we know that the vaccines have proven to be safe and effective. They limit the disease in the individual, including hospitalization, death, and long-term side effects. So even though efficacy may be waning, we are still not seeing those high numbers back in the hospital. And then the importance of establishing that we're going to limit the transmission to others when we receive the vaccine, that if we're having lesser symptoms from COVID or not getting COVID, we're not going to have as many missed days from school and work. And then if everybody is receiving the vaccine, then we can have that decreased emergence of variants. So the COVID vaccine, COVID and myocarditis, this slide is sometimes ever changing but it's good to kind of separate out that material because a lot of families hear about, the vaccine and associated number of cases of myocarditis. And from some of the articles that you can pull, there was at a point in time over 1,600 confirmed cases of myocarditis associated with the vaccine, but you have to think about the millions of doses of vaccine that were given to, make that only of that 1,600 cases. All of those are really mostly self-resolved. 98% were out of the hospital with a 1 to 2 day average hospital stay. And then 87% were actually resolved upon discharge. The mean age was actually higher. It's more in the adolescents and the young adult population, with males being the higher number of cases. If we looked at COVID and myocarditis in the general population, not just in the pediatric, a study in 2020 put out by JAMA showed an increase in all myocarditis cases by 42%. So that was when COVID was really live and happening and infecting several individuals. So they had over 4,560 confirmed cases in 2020. The distribution was similar among males and females. 40% had a confirmed COVID diagnosis. Children and older adults were actually most affected. So this was also hitting the younger population. And if you compare that risk, you're looking at, based upon the new CDC data, up to a 6 times higher rate than the vaccine-associated myocarditis. And then we even have to think about MIS-C tied in there, and the primary clinical criteria is having a cardiac abnormality. And our total number of cases up to date is over 8,000 cases with over 70 deaths with a median age of 9 years. And you can see the age group there established at 50% of the cases is 5 to 13, affecting the Hispanic, Latino, and Black population at about 57%. So how do we go about this? That's the motivational interviewing and thinking about this in a stepwise approach and thinking about taking the time to do this in about 5 or 10 minutes, because I know we are all busy. And so that's where you do. I find that I get along with patient families better if I take that deep breath, I smile, and I'm engaged. So you want to sit down and have that comfortable environment. Even as a hospitalist, you think I'm walking into a room, I will find a seat somewhere and try to make direct eye contact. I try to understand that my population's from different educational backgrounds, cultural backgrounds, as well as their socioeconomic status may be different. And then the important key piece, especially about the COVID-19 vaccine, is to ask permission. I think that sometimes helps, especially when we're now talking about taking this participatory approach. So have your question. Be specific. May I ask, what concerns you might have today about the COVID vaccine? Or may I ask, what have you heard or read that's concerning to you about the COVID vaccine? And if they aren't ready to engage in that conversation, let them know it's okay and that you would like to discuss it another time. And then you can get some engagement about where they are at on a scale of 1 to 10. Because some of the times when you ask this question, they may give an answer, but you don't really know like how hesitant they might be or how accepting they might be. Sometimes that scale can help you get to that point of understanding that better. And then be ready to respond to the questions. And so when they do say, perhaps they are worried about myocarditis or a side effect with the vaccine, you can repeat that. I understand that you might be worried about the safety of the vaccine, and try to have that focus on what they're worried about and try not to be too tangential in your conversation, but stay focused about what their concerns are. And if you aren't ready to establish and need to read up further, you can let them know that you want to pull in more information and get back to them. It's okay. I say that all the time. Let me get back to you. let me look this up. I think it's important that we are both informed appropriately. And then you want to see after you're gone through this process, what are their next steps? Where are they currently at? How do they feel? So that empowers them to give you that point in time where they're going to be going and where you can go with them to get to that point of hopefully accepting the COVID vaccine. In this ECHO series, you're going to have further discussion about myth busting. I never thought that we would be called the myth busters, but I feel that we're out there, you know, those myths are out there now, and we need resources. And so there's actually a debunking handbook that the AAP encourages to go through. And it's a really easy read. I have some key features of the handbook here, but they'll be in a resources at the end. The important thing is to ask the parent about the resource that they got it from, what to consider. So, you know, where did you read that? Do you know that organization? You know, do you know what else that they advocate for or they are concerned about? What their motivations might be. Sometimes you can ask them to nicely challenge, what's going on when they have read that myth, and then warn and then explain how the myth misleads one time. So explain why you thought, explain why it was thought to be correct and why it is now wrong. And then you can go to the fact and restate the fact. And it's okay to restate it in different ways that they might understand. This debunking handbook has done studies, and there have been systematic reviews stating that when you go with the facts and that you repeat some of the facts in other forms or manner, you're not going to have backfire overkill. And then putting those complicated facts into your own words is really, truly important. So we can look at a quick case example, and then we're going to talk to our panel. But we have a 13-year-old who comes in with a mom. They're concerned about ingredients in the COVID vaccine that may be toxic to my child's body. And that's where you say, may I ask what you are concerned about in particular about in the ingredients? So that's a good question to ask. And then as they describe an ingredient that might be concerning, I can see you're concerned about the safety of the products in the vaccine. I understand very much about you're concerned about your daughter's safety and what she receives in an injection. So let's talk about that. I have put much thought in reading into the understanding the safety of the ingredients in the vaccine. Is it okay if I tell you what I've learned about this? And if they're obviously willing to accept, that's where you can talk about your resources. I've looked into my resources that I use as a pediatrician, anything that I study and I care for as patients. And the COVID vaccine is held to the same standards as all other vaccines. Over 10 years of research has happened even prior to the start of initiating this vaccine to the public. We now have given over hundreds of millions of doses, and they have shown to be safe. The ingredients that were used are there actually to make the vaccine as safe as possible to administer. I feel better by giving the vaccine to my patients and my own children, so to protect them from getting COVID, as well as protecting those individuals around them. And then, the reality, handing it back to them. This is an important decision. I want you to think about this. This is a decision only you can make with your child. Let me know what you think. You can discuss it now with me, or if you want to discuss it at a later time. And then, make those pauses to see where they're coming at. And then please, as you go out, talk about the resources again. Try to stray away from social media. Let them know you use I use the AAP, I use the CDC. Those are where I get a lot of my resources from. And, just quickly looking at those quick facts again, knowing that this is as of July of 2022. So our death rate from COVID for children 0 to 18 is probably over 1,300 now. It includes 202 children in the age range of 6 months to 5 years. And that was from January. That data is from January 2022. I already delivered the MIS-C cases But knowing that we are still seeing COVID cases in the hospital, we did see a spike in the COVID cases when Omicron came around. And the hospitalization rate for children 5 to 11 has shown to be 2 times higher among unvaccinated over vaccinated children. We'll talk about practice takeaways in a minute, but I want to leave this open for our panel discussion. And these are my 2 children. You can see one with angst, one with happiness with receiving their COVID vaccine, but that's important to understand too.
Thank you very much, Dr. Svatek, for this presentation. And I would like to introduce our panelists for our discussion today. We have a Dr. Barton.
Hi, thanks for having me.
Thank you very much. And we have Dr. Burns.
Thank you for having me today.
We have Dr. Case.
I am.
Thank you. Thank you very much, Dr. Bergen.
All right. Thank you for having all of us, and I'll be the moderator. Did we have, there's Dr. Hanson. Could you just introduce yourself briefly, Dr. Hanson?
Yes, hi, I'm Liz Hanson. I'm a general pediatrician and educator here at the Health Science Center.
Well, we're very grateful to all of you. This is a robust turnout for a panel of experts, and I'm sure there'll be a number of questions. We're going to take a few minutes for Q&A, then we'll come back to Dr. Svatek's key takeaway points, and then we'll do another case. So I have taken my moderator's privilege and I put a question in the chat. I think I didn't see any other questions. I noticed, Dr. Svatek, you talked about the announcement approach training and that this has been studied and shown to be actually very effective in getting HPV vaccine, a different vaccine, taken up in adolescents. So the way that we talk to people about vaccines clearly affects whether or not they're going to get the vaccines. And so my question is, are there studies looking at the announcement approach training for the COVID-19 vaccine, or is a different approach needed?
Right. So right now, looking through that data right now, there isn't like established practice guidelines for the pediatric population. I wish they even had a ReadyVac trial trying to give an informational interactive base for pregnant women, but that's actually not associated with the COVID vaccine. They haven't come out with their new data to show any positive approach with using a computer-based site to educate. But no, I wish they would develop that. I think that's obviously going to come in time. It's going to take some time.
And if I may, I'd like to toss that question to Dr. Burns. You're a seasoned clinician here in San Antonio. And are your thoughts that there are differences in how we approach COVID vaccine in the pediatric population compared to other vaccines, and the way that we present the opportunity and the need for vaccination to parents? Dr. Burns.
Yes, I really do. But I think part of the issue is that COVID vaccine has been so politicized, unlike other vaccines. Everybody, pertussis, all of the vaccines, and pediatrics is always the key part of pediatrics is vaccines. We're prevention. So it's really an unusual that families and parents are not interested in getting a vaccine. But I think that's in part because it has been so politicized, and in part because our country has started to make people aware of why things should be an issue. For example, for minorities, particularly African Americans, taking that the vaccines would be no issue, except everybody now has reminded African Americans how they were discriminated against and used as experiments in medicine, which is something we never talked about when we were trying to encourage people to get polio. And polio was given just in mass immunizations, and nobody considered that as a discriminatory act. But now we have started to refocus medicine. So I think it's in part the hesitancy comes from our politics and the division in our nations about COVID vaccine, because obviously for our children, it is important to get vaccines, and most people have never experienced any of the vaccine related illnesses that we see. So it's not like it comes from a point of experience. So I think that the approach to this vaccine will have to be generally more accepted. And I believe in time, probably over the next year, COVID vaccine for our 6-month-olds will be just as routine as getting the flu, which is probably one of the vaccines that's not quite 100% accepted now, but I think it'll be on the same level as getting the flu.
I love the optimism there, Dr. Burns, and we will join with you in that optimistic view, especially out of consideration of your years of experience. I want to give our other experts a chance to weigh in about approaches to communication about pediatric COVID vaccine. Announcement, presumptive, asking permission. How are we changing our approaches with this particular set of circumstances? Dr. Barton?
So I think, I think it's actually important for us to acknowledge, besides kind of the politicization of this particular vaccine, that, this is a new thing, and some of the things that I think are scary for parents are, we have a vaccine that's kind of a new technology. We have a vaccine that, it's effective, but it's not as effective as some of the other vaccines that we use at this point against the variants. And so I think that, the thing, reminding ourselves and then reminding families of, like, it's really remarkable that we actually, even though this vaccine isn't perfect, that we have a vaccine that we can use in real time with an ongoing pandemic. Like, the way that we've really addressed things in the past is we've had these terrible diseases that have been hanging around and, killing children or harming children for, decades before we're able to actually have a preventative measure. And so the fact that we have in really rapid time something that's available to try to address this, even though it's not perfect, that's really special and remarkable.
Thank you. Anything to add, Dr. Hanson?
Yeah, I would say, I think along with what Dr. Barton said, this vaccine is still under emergency use authorization. So to me, that makes it feel a little different to use a presumptive approach, because I think especially some of the questions around in the youngest group, co-administration with vaccines, if you look at the EUA, it says there's kind of no data one way or the other, but that should be a discussion with the provider. So to me, that means I need to walk in with a little more of a discussion approach than what I would do with other vaccines, where I do very much use that presumptive approach. These are the vaccines your child is due for. I will say we also have the COVID vaccine now available, and we recommend it, maybe give that vaccine as well. And it doesn't, I also don't know with the politicization if the presumptive approach will be as effective as with others, because there are some parents that are very suspicious. So we've had families who did not want the COVID vaccine, who then want to inspect all the syringes when the MA brings them in to make sure we're not like sneaking it in. And so that to me also underscores that I think we do need to be a little perhaps more open in the way that we discuss it, because there are some families that they're so afraid of this vaccine because of what they've heard, that if you were overly presumptive, they may actually take that as undermining of trust. So I'm not 100% sure what the best way is, but we try to be as encouraging as possible. The availability is also a little different. Sometimes we have it in the clinic, sometimes we don't. For certain age groups we do, for certain we don't. So then it's a little bit different of a dynamic as well.
That will come up in the case that we're going to go to in just a moment. And before I go to the case, I'm going to ask Dr. Svatek to take us to your key takeaway points. So for those who might have joined us late and missed the beginning, what are the main things you want everybody to walk out of here today with as practice takeaways?
So, we'll hear about certain pediatricians, being dismissive in their practice for patients and their families that do not want to accept taking vaccines. And I think, COVID in the COVID vaccine has brought a new light to all of us. And, we talk about the politicization and everything else, but I think the important key is to understand that we can work towards these opportunities. We now, I think, have better resources to discuss vaccine hesitancy. I became a lot smarter even with creating, this presentation and practicing over time. And so dismissing anybody from your practice and get into that habit of trying to take those key approaches of motivational interviewing, using open-ended questions and straying away from that term "but" in your responses, because oftentimes it can negate anything that you said before that. And if you're trying to explain a myth that a family or parent has come to you with, you don't want to negate them. You want to be positive. And then, the key features is to tell your own stories. You have your own experiences. You've seen children sick with COVID. You've seen family members sick. You've seen other vaccine presentable diseases present in your office or in your healthcare setting. It's important to bring those stories in, make it personable. And then, really have that opportunity to reach out to local schools, organizations in your community to spread the word, because they look at you as somebody that can be respected. And the more that you speak up and speak out in an admirable way, I think that goes a long way to start in relinquishing some of the hesitancy that's going on in that community.
All right, a pep talk. Pediatricians unite. We got a lot of work to do. Thank you so much, Dr. Svatek. And Carly, if you could bring up the case, I'm going to, as you're bringing that up, I want to remind everybody on this ECHO team that you are invited. All of y'all are invited to send us cases, and we've tried to make it even easier than ever to submit them. There's a red cap form, and you just go click, 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 and fill out the form. So I filled this one out. This is a real thing that happened to me. I was hiking in Colorado in July, and I got a call from somebody that I know in the community. And the voice message said, "Hey, Dr. Berger, and I just wanted to talk to you about vaccines for my boys, as I'd mentioned to you earlier, and if you could call me back, I'd really appreciate it." So we scheduled a call, and I was immediately put on speakerphone. And so suddenly speaking to both a mother and a father of two little boys. Both were under the age of 5 and healthy. Whole family is healthy. Mother and father have both been vaccinated and boosted. So this is not an anti-vaccine feeling family. So what's the problem? You're probably wondering. It turns out mom and dad are both professionals. They both have public facing jobs. Dad is a paramedic and mother is a clergy member in a local congregation. The mother is very favorable to having the boys vaccinated ASAP, and the father is hesitating. He's the one with the health professional background. So what was the underlying problem, the misconception? And on the phone, Dad introduced himself and he said, "In my profession, we do a lot of first responding for COVID, and I'm vaccinated, but I worry about the side effects for the vaccine in my children. Since healthy children are at such a low risk of a bad outcome from COVID, why should I subject them to any risk at all from this vaccine? And I'm hearing a lot of negative stuff about vaccine side effects in kids from my colleagues in the paramedic world." Father did not have data that he cited, but he was quoting his respected colleagues within his professional group with whom he identifies strongly. And the mother added, well, that about half of the people in the paramedic groups that they're aware of seem to be opposed to vaccination. And they also seem to be somewhat politicized in their thinking about vaccination. So the delivery mechanism, how did I get a hold of this? It was this phone call in person. If y'all are filling this out, you might have come across a flyer, seen something online, heard something from a friend. But here we have two parents getting together to seek advice from a doctor who's not a pediatrician, but just a doctor that they know, infectious disease doctor. So here's how I responded. I acknowledged upfront that, is there risk from the vaccine? Yes. The thing that has come out that especially would be salient for parents of boys is the potential risk for myocarditis from the mRNA vaccines in particular. But I stressed the age range where the myocarditis seems to be most significant. And I pointed out that the data still suggests that the risk of myocarditis is higher from COVID itself than from the mRNA vaccines. And I offered the information that there are other vaccine platforms. Novavax vaccine is getting underway. These are non-mRNA vaccine platforms, and those might be ideal for adolescent boys in the future. And I acknowledge that as we keep learning more about vaccines and their side effects, we're going to be tailoring our recommendations for certain populations. Just like right now, we don't recommend the J&J vaccine. It's specifically for women of reproductive age because they have this risk of an unusual type of dangerous blood clot. So we try to be very data responsive. And so in a nutshell, I just didn't say, oh, don't worry about it. Your kids are not at any risk. This isn't a danger to them. You should just go ahead and get it. I acknowledged what the risks were and tried to provide him with some frame of reference of relative risk of the vaccine versus COVID infection itself. So they were pleased. I spent about 20 minutes on the phone with them. I thought the rapport was good. I did not make anybody feel bad about asking questions. I felt like we reached a level of comfort that they could ask whatever they wanted to ask. My questions for you all, as this is an all teach, all learn community. My question is, if this were not a highly educated professional couple with a paramedic father, would you take a different approach than I did with quoting the data? And I'm going to go first to Dr. Burns again, seniority.
Okay, thank you. See, I probably would not approach my average patient with a lot of data. I think the first thing that you always do is you listen to the patient and then you relate to their life situation. So if this is somebody who's talking to me about messenger RNA, then I might talk to them about cancer research and how messenger RNA has been used in that. But most of my patients only know the term messenger RNA because they've heard it on television, but they really don't know what it means. But so I usually try to relate things to their situation. I listen, I find out what are your concerns about getting this vaccine, and make them aware of some of the factors that really predispose their family members. And generally I relate to their families, and I relate to the unpredictability of disease. All diseases are very unpredictable, just like our vaccines are unpredictable. And I again tell them, relate sometimes about the deaths and the complications that we see from many of our other childhood illnesses that we don't expect, from these that we see from the possibility that every medicine we take has some side effects, and that's very, very unpredictable. But if that side effect occurs to you, that is 100%. And we all love our children. Really, they're the pride of our life. And you would do anything to keep your child from suffering from having just a runny nose. What would you do to keep them from suffering from COVID? The possibility that COVID can go to somebody who's more vulnerable. I always use polio. We used to, when we gave oral polio, it was a live virus. I talked to you about not giving you that virus if somebody in your family was immunosuppressed. So we always consider not just ourselves, but our community. So most parents, if you talk to them, they will listen if you can talk to them in terms that they can understand. And you definitely, you definitely sit down, and you are never condemn their thought process. You always accept what they say and acknowledge their concerns. And I think everybody appreciates that.
I picked up from both you and Dr. Svatek the importance of acknowledging how much the parent loves their child when you're talking about a difficult decision, the caring, and trying to kind of ally your message about vaccination with how much you know that the parent cares about their kid. Thank you for that. Could you scroll down, Carly, on this? I have a little bit of a follow-up. I got a text message from another pediatrician, not somebody on this call here, who sent this text message for me to share with the couple, because I said, did I do everything right with this couple? What are your thoughts? And this pediatrician is also a parent, and I was permitted to share this text with the parents. And she had said, I'm actually working to get an appointment for my child now. We missed the big community event, and you can't take kids under 3 to a pharmacy, which is a bummer. I get why parents are not raring at the bit for this vaccine. I wish we knew more about efficacy in this age group. We will eventually, of course, but for now, it does seem like it's mostly for the population level benefit. And any individual kid's pattern of immunity is a drop in the bucket, with overall vaccine rates being so low in kids. However, COVID has killed more kids under 5 per year than many vaccine preventable diseases were before the introduction of vaccine. So we just don't know how effective these vaccines will be in changing death rates or MISC or pediatric long COVID, but I think there's good reason to believe we'll see the same pattern we've seen in the older groups with reduction of severe disease and death with vaccination. It's just going to require a larger sample size. So I think the value in sharing this text message with the couple was this was coming from a pediatrician, not just an adult infectious disease doctor, and someone who is a parent. And it acknowledges some of the difficulty that parents are having. And this is a theme, since you can't get the little kiddos vaccinated at the pharmacy. If you miss a big vaccine fair, then you've got to go by appointment, and not all offices are fully stocked. So this is a question now back to the panel of experts. Is that a problem with how we're rolling out pediatric vaccine? Anybody want to comment?
I'll comment. I think it is a challenge. I think it's a hard nut to crack, though, because this is new in this group. We've had very low uptake, so we've had sort of doing experiments almost in our clinic, where we'll try giving it in our clinic, and then we might only give out 1 vaccine dose for an entire vial, and then the system says, well, that's why it's better to do this age group at these bigger events. So I think there are challenges to both ways, but you definitely lose something when you say we recommend this vaccine, but we don't have it. So you're going to have to make an appointment, and then you can't sign up till Friday, and the appointments fill up really fast. So I think we definitely lose opportunities, but it's also there's some systematic challenges to giving it in the clinic. I did a little straw poll of our graduates, and it seems like a lot of the private practices actually do have it this younger age group for their patients, but they're not like offering it widely. So I think you have to, it's hard to know how to advise families. They definitely should check with their pediatrician.
Dr. Bergen, you are muted.
I think I would learn. So we're getting close to the end of the hour. I wanted to point out that there's information in the chat from our ECHO IT folks. Carly, thank you for putting in the 2 steps to obtain continuing education credits. These are free. They are CNE and CME, and there will be an ethics credit session as well. Sessions that you can anticipate that are coming up are going to be next time will be an overview of why it is that health literacy is important in helping us attain equitable health outcomes throughout our society for COVID-19 and other preventable diseases. We'll be hearing about myth busting, digital health literacy, incorporating cultural awareness into communicating about vaccines, pediatric long COVID by Dr. Tess Barton, adult long COVID by our chair of PM&R, Dr. Monica Verduzco Gutierrez, and vaccine update for adults given by Dr. Barbara Taylor. That's not quite the whole 10, but that's what's coming up. Please help us spread the word. We are committed to making sure that our community has all of the very latest and the best information, but that we present it in a format where we have this all teach, all learn environment. We're learning from one another, and we're getting tuned in to what's actually happening here in San Antonio, which is most relevant for our clinical practice. So with that, I am going to cede the microphone back to our ECHO Hub team. Thank you.
Thank you. Thank you very much, Dr. Bergen. And I would like to thank everyone to make this time and join us, make it your priority in this time. I would like to thank our panel of experts, Dr. Barton, Dr. Burns, Dr. Case, Dr. Hanson. Very Very interesting conversation, very important didactics. Dr. Svatek, thank you very much. And these sessions are gonna be every 2 weeks. Please mark your calendar. And our next session is gonna be August the 19th. Also, I invite you to submit cases. That will be very, very important for us. And complete those pre-surveys and the post-session feedback survey. Your feedback is very important for us. Those sessions are possible because of you, your interest and your participation. And we're here to be part of this learning network. Thank you very much, Dr. Bergen.
I wanted to mention, we do have incentives this time. So if you attend all of our sessions and fill out all of the evaluations, you will get a certificate, a Health Confianza certificate that you are a COVID-19 health literacy champion. And you'll also get a lovely lapel pin with that wonderful happy Health Confianza logo. And if you can't make all of them, we still have something for you. If you can make 50% or more, we will still give you the lapel pin. And we thank you for your attendance. And we ask you to go forward and be health literacy champions. We've got so much work to do to vaccinate the pediatric population. So thanks a lot, everybody. Thank you, Dr. Svatek, Dr. Burns, Dr. Barton, Dr. Hanson. We're glad you were all here. Katie Case, thank you.
Thank you. Until then, see you next time. Take care.